Well, ladies and gentlemen, you are most welcome to this very important program that we have. We have about 18 people in the house. Already we have about 80 people in the house, which is very good. Risers. But we are waiting for the minister to come in because we cannot sing the national anthem without the minister in. But for all of you who are here, I thank you so much for coming so early. We use the opportunity to recognize people in the house. Yeah, very well. You brought this. You brought this one. Okay. I want to use it. I've seen the moderator of the day in the house. Yes. He has so many names. The grandfather. The grandfather, the immediate past president of Pharmaceutical Society of Nigeria, Alhaji Ahmed I. Yakasai. I will not make a mistake of calling Ibrahim now. So it's Ahmed that is permitted for us to call. Many other people that I've seen in the house, we're happy to have you. Like I said, we wait. I think the house is getting full, and this is good for us. Damola, how many people do we have? 23, yes. As you admit more people, we just wait a little. This is a public event, so we cannot, we don't want people to miss the important thing that we are here for. Therefore, you exercise some patience, please. What did you do to my head?
Feedback. It's feeding back.
But I need to be seen. I can't see them. I can't see them. I have muted it.
No, it's sorry. It's a laptop.
The laptop did not work.
Feedback.
Okay. Let me use the laptop. I'm here to see that round face. So, Azu, are you in the house? Wow. Is he in the house? Azu BK? No, that's another past president. That's another past president of the Pharmaceutical Society of Nigeria. The man I finally called my president. That's Azu BK Okwo, FFIP. FFIP, the only man in Nigeria, I think Africa, who answered that name FFIP, that title FFIP. Yes, 33. I think, I've seen fellow Paul and Ebele. You are welcome, sir. Thank you for always being there. Well, I need to. So, Mr. Raji, is it okay for me to log in on the laptop, right? Is it okay? you are around. You are the only one permitted to unmute yourself now. Hello, Boss Azu, you are around? We see you. Can you please confirm the presence of the minister? We have 48 people in the house already, but I'm not sure where the minister is. Sir, to you, sir. Could you let me call Azu? When will the minister come? Oh, Richard is here. Richard, you, the senior advocate of Nigeria. We thank you for joining us. That's right. Is he here? Yeah. But they're already online. I told them to come and see them. Yeah, 52 people in the house now. The number is increasing, but like I said, we can't do this behind the minister. We can't sing the national anthem behind the minister. And I can assure you we have somebody troubleshooting on that already. So I will still ask for your patience. But like I've been seeing here, a lot of people online. Very good for us. I've seen our professors. Reo Zolua is here. Ike Muzochukwu is here. We are together early in the morning today. Professor Sodipo, all the way from Maiduguri. Thank God for Zoom. This has really broken down the distance. She's in Maiduguri and she's here with us. Yes, so many people here. Nice to see all of you. Thank you for coming around. We'll start very soon. $57, increasing. Oh, Sir Antonio Ime, thank you for logging in. I've started you. Thank you for logging in. The ex-national treasurer of PSN and the president of Nigerian Guild of Editor. Sir, I've seen you in the house. I was expecting you to be by our side here, but it's okay. We thank God for you. Olake Adeniyi, like I was saying, ex-national treasurer of PSN and now assistant secretary general of Association of Professional Bodies of Nigeria. In the house here, we have quite a number of people. Sorry, sir, can I have that? Yeah, that one. I have some early people who arrived so early. Dr. Olufonso Awodele, fantastic. You are most welcome from Department of Pharmacology, University of Lagos, an associate professor. Dr. Victor Ikumawoyi. Oh, wow, I like that. Ikumawoyi. It's only you that Iku should not look at. In actual fact, that name should be for all of us. Iku should not look at us at all. So, He came in so early. He has been in the house. One of our panelists today who arrived here at 9 a.m. That's Dr. Jimmy Arigbabuwo. Dr. Jimmy Arigbabuwo is the president of Healthcare Providers Association of Nigeria. He's been a very good friend, and we've been working together on projects that affect the country and that can make our country better. And of course, in the house, we have our Papa, the chairman of the committee set up to organize this very important media week. He told me today that my head is branded. At any time you see my head, you can know that that's Lodojo. But he is the branded man with the beard that we know, Sir Ifeanyi Atueyi. Thank you very much, sir. It's always good to have you in our presence. We have the former Stream TV crew led by a pharmacist himself, very reliable, always there, anytime and every time you ask him to come. I'm talking about pharmacist Kabiru Raji and his crew member. They are here. I have the young lady, Lola. Okay. Oh, Lola Falulu, that's it. The name of, that's great. Yeah, the numbers keeps on increasing. We have 60 now. But like I said, please let's just exercise a little patience for the minister to come in. All right. It's okay, we cannot wait ad infinitum because this is now 18 minutes of waiting, and we already have 64 people in the house. I think what is clear is that we will start, and anytime they come in, we will pause to take the minister and the other guests that we are expecting. May I therefore call on the former stream crew to give us the national anthem. Let's rise for the national anthem, please. Thank you very much. You can take your seat now. Thank you. Well, as it is our practice in this part of the world, and we are right because of our belief in God, may I call on Dr. Olufonso Awodele to just give us a word of prayer. Thank you. Can you help me pass the microphone to me? Just stay where you are. Stay where you are. Thank you.
Shall we pray? Our everlasting Father in heaven, we are so grateful. We thank you for the grace you have given us to gather this morning to discuss our topical issue. We pray that the Holy Spirit will lead us as we discuss this morning. We pray that thou grant us understanding and take absolute control of the program today. Thank you, Father, for answer prayers, for we have prayed with thanksgivings in Jesus' name.
Thank you so much. I know you are here as a professor, but I'm almost make you an assistant pastor now. Or are you a pastor already? Thank you very much. May I ask if my bosses are in the house? I've been calling you. You have not answered me. Azu, are you in the house? Azu is my boss, and the group managing director of Leadership Newspaper. Are you there? Because if you are there, you are supposed to take some recognitions now. Okay. While waiting for Azu, I think it's important that we start this, and just permit me to remove my mouth dress. Because I remember when we were in the NYC, they say remove hair dresses, right? So this one is a mouth dress, so I've removed it. Once again, I want to welcome all of you to this program. We know certainly that Monday is not the best of days to gather people together. But because we are taking a decision to have this media week run from Monday to Saturday, that is why we have not spared Monday. I want to appeal to you, since you are here already, let's enjoy the program. Let's make contribution. Let's be able to impact our people. We invited non-pharmacists, non-journalists, but one of our panelists telling me today that he has sent the invitation to everybody, which I said, that's a very good one. So I'm expecting that as we progress, the house will be full. It will be an understatement to say that COVID-19 pandemic has impacted our world. It has changed what we used to know. And what do? Like one epidemiologist said, that all we have done so far in navigating the COVID-19 pandemic way is for us that we clambered on life raft. Clambered on life raft, that is where we are now. But the dry land is still far away. The dry land is still far away. And our exit strategy is science. This is what we really need to know, that our exit strategy is science. Somebody told me, but it's God. I said, yes. Our Lord is the God of science. He gave us the wisdom. He gave us the knowledge. He gave to human being. It's there. If we read our Bible, the Lord gave the knowledge to man. Nothing that we have that has not been given to us. So the knowledge that is being used to bring this, to bring that, is from God. So our exit strategy is science. We can't afford to do nothing. And this is what brought pharmacy and media together. You will hear more about this coalition, so it's not really my bit to talk more on that. You'll hear more about the coalition, but the truth of the matter is the president of Nigeria Academy of Pharmacy, the president of Nigerian Guild of Editors, thought it fit that we should combat this pandemic with the right information. But somebody put it rightly, fight the virus with the right information. So, especially now that a lot of information are circulating, half-truths, outright fake, misinformation, controversy, conspiracy theories, all sorts of things. And we have a responsibility as people who know to dish out the right information so that our people can be saved from this pandemic and they can be helped to cope with the impact of the pandemic. So this is the reason why we are together. I am expecting that more Nigerians will join us so that they can benefit from the program. I'm still optimistic that with time, the minister will join us, because as at yesterday, we got a request for the program, we got requests for the format, and we want to believe that very soon they will join us. Now, we go on to the next program, and it is my pleasure to introduce the president of the Nigeria Academy of Pharmacy. Time is not going to be our good friend, so I'm going to lead by example by being very brief, because if I were to introduce the president of the academy the way he's supposed to introduce, if I were to introduce him with the dossier that I have for him, then we may be spending the 2 hours allocated for this program on that introduction. But permit me to say that we have with us a special person, somebody specially made by God for us, because he has done a lot for us. A former Minister of Health. I'm talking about Prince Julius Adelusi Adeluyi. He will talk to us now on why we are here. Thank you very much, sir. You are welcome, sir.
Thank you, Dr. Lulu Ojo, the Director of Organization of this program. We thank God. We thank God that this program is eventuating. I'm particularly pleased that we have news that the Honorable Minister is on the way. But we're happy that Dr. Chikwe Andreas Ihekweazu, the very famous epidemiologist, our guest speaker, is already here. Doctor, you are welcome, and we look forward to your speech. Dr. Ihekweazu has been described by some Germans as the Eingrundliche Professionell. That's a thorough professional. He's always proved that he is a very thorough person in whatever he does. We also want to recognize straight away Issa Mustafa, who is the president of the Nigerian Guild of Editors. I also want to pay my respect to the organizers of this particular program. It's not easy to organize anything in this part of the world, given the current circumstances. Ifeanyi Atweye is the deputy president of the academy, and Azu is also a co-chairperson, and they've worked so hard to make this happen. I welcome all of you. I can see some media people here. And all you distinguished ladies and gentlemen who are in the house, you're very welcome. Taking off time on this busy Monday. I also see past leaders of the Pharmaceutical Society of Nigeria. One of them will be the moderator on today's occasion. You're very welcome, also with the leadership of the NGE. Now I'd like to bring you warm greetings from the Academy, as well as from the Guild of Editors. And I trust that we're all keeping safe and abiding by the protocols of COVID-19. Some people ask, why are we having this at this time? Why not before or maybe later? But I dare tell all of you that the time is always right to do what is right. This is the time to do it, and we are doing it. Thanks be to God. I especially welcome all of you to the flag off of this unique collaboration between the Nigeria Academy of Pharmacy and the Nigerian Guild of Editors. The editors are the people who are strong in advocacy, and the pharmacists are scientific professionals. So when they provide the content, then the people in the media also do the advocacy. You can have a better synergy. Today's program and the next few days seeks to guide Nigeria towards a new turn in the nurturing and management of scientific knowledge for the overall benefit of all Nigerians. In this regard, we have assembled a diverse team of professionals from across the healthcare sector and beyond. And they will, over the next several days, examine a wide range of subject areas that relate to the COVID-19 pandemic. Now, the COVID-19 pandemic has in many ways been a grim reaper of sorts in Nigeria and elsewhere in the world. It has occasioned unprecedented loss of lives, and instructively, the pandemic has also demonstrated how science continues to help overcome challenges posed by diseases, and in this way, making our world safer and more livable. We've told you about this collaboration between the Napharm and the NGE. We think that this collaboration is particularly heartwarming, and I trust that the next 5 days will demonstrate how much more effective we can become when we put our differences aside and combine our talents and abilities. It is, I dare say, a good lesson for Nigeria's healthcare practitioners. In the science of management, the word team has now been represented by a few other words like together, each achieves more. Team. Together, each achieves more. So when in our togetherness we face any particular issue, we have a way of being more successful. Now, this collaboration exercise seeks to achieve 3 critical objectives. The first of these objectives is the need to complement efforts by government and other organizations to mitigate the impact of the COVID-19 pandemic on our people. Now, close to 3 million lives have been lost around the world to this pandemic. Who knows how many people of this number may have been casualties of fear, casualties of myths, of conspiracies, and even sheer ignorance, rather than by the actual disease itself. Ladies and gentlemen, this is one reason why education is so critical. Education underscored by facts, by data, and by science, not by myths, not by rumors or conspiracies. Jointly, we will disseminate factual information pertaining to the COVID-19 pandemic. We will also help to dispel unfounded and pseudoscientific misinformation that unfortunately appears to have gained currency across large segments of our population. The truth is that advances in science and technology have led the world to a situation where it is now possible to respond very quickly to the COVID-19 pandemic via the development of vaccines. It would be a tragedy, ladies and gentlemen, if Nigerians, our own people, are, by acts of omission and commission, disempowered from benefiting optimally from these scientific advances. Now, the second objective is for us to encourage government to beam the searchlight once more on the sorry plight of scientific research in Nigeria. Government should prioritize anew on scientific research. For many years, the Nigerian Academy of Pharmacy has raised the issue of inadequate prioritization of scientific research. Now, this inadequate prioritization is responsible for the pathetically poor funding of scientific research, primarily by government, but also by the private sector. This is why what ought to be research laboratories are often derelict and devoid of modern-day equipment and facilities. Now, in such circumstances, many pharmacists, many pharmaceutical and medical scientists, and other researchers are unable to optimize their long years of training and their ambitions to develop new drugs and substances to manage diseases and infections. Many of such researchers, in fact, routinely seek greener pastures abroad and have been known to excel in these countries. This has to stop. We have the brains here in Nigeria. We have the flora and fauna here in Nigeria. We must prioritize on scientific research a lot better than we have done in the past. We must become more inclined to investing in relevant knowledge. Scientific research in our universities and research institutes, such as the Nigerian Institute of Pharmaceutical Research and Development, NIPRD, and the Nigerian Institute for Medical Research, as well as other indigenous efforts, needs to be boosted with more funding. Ladies and gentlemen, our researchers need to be better motivated to deliver value from our laboratories. And in saying this, we're asking our people to learn from the COVID-19 pandemic. The only reason that a good number of vaccines have emerged, seemingly in record time, to tackle this unfortunate pandemic is because for decades, the global scientific community had dedicated enormous intellectual and financial resources towards research. For example, the use of the mRNA by Pfizer and Moderna in their research, and the use of adenovirus vectored vaccine research by AstraZeneca, by Johnson & Johnson, by even Sputnik, among others. Where would the world be today if these scientific researchers had not taken action? Advances that have been recorded with these vaccines so far are such that the world now has hope that we're getting closer to achieve vaccines for other diseases like malaria. So once again, as we have done countless times in the past, we implore government to prioritize on scientific research as well as on pharmaceutical, medical, and scientific education as a whole. The third and last objective of this whole exercise this week is to urge government to enhance its capacity for the nation to tackle future epidemics speedily. Now, during this exercise this week, we intend to document lessons which Nigeria needs to learn from COVID-19 pandemic. And we urge the government to imbibe this discipline to put the lessons to play in the unfortunate event of a future epidemic. If a small country with 11 million like Cuba is now on the verge of producing its own vaccines, Nigeria, with about 200 million people, cannot afford to sit down and look. It's about time we started action. That's why we say that by all means, this nation must not allow the COVID-19 crisis to waste. Very importantly, we want to reiterate that knowledge remains pivotal to human progress as the COVID-19 pandemic continues to demonstrate. we earnestly urge the government of Nigeria to commit more seriously to investing in broadening and deepening the frontiers of scientific knowledge in this country. Finally, allow me to have some words of commendation. I very specially commend the leadership of the Nigerian Guild of Editors, and I salute the enthusiasm with which the NGE has committed itself to collaborating with the Nigerian Academy of Pharmacy to achieve the 3 objectives laid out earlier. On behalf of the Academy, I can only request that every effort must be made to sustain this enthusiasm and ensure that the enthusiasm waxes stronger with the fullness of time. Because working together, we Nigerians can conquer any disease, no matter its nature, no matter its direction, no matter its timing. And in so doing, ladies and gentlemen, we can ensure a better and healthier lifestyle for all Nigerians. Again, I thank the Minister for still planning to come, but I thank Dr. Chikwe Andreas Hekwezu, the famous epidemiologist, for taking time to be with us. And I thank all of you who are the organizers. I even thank people like lawyers. A good friend Richard is here, for making time to be here. By the grace of God, the time you have invested here will bring benefits to you and yours in the future. I thank you, and let us proceed.
I think the president of Nigeria Academy of Pharmacy deserves more applause. Can we give it to him, please? Yes, thank you very, very much. We appreciate you. And like he has said, thanks to Dr. Chikwe Ekwazu for being with us. I'm sure you are ready for us now. And at this point, I want to call on my dear friend and brother, Professor Emmanuel Ibezim, the national chairman of National Association of Pharmacists in Academia, to please introduce our keynote address speaker. Professor Ibezim, please.
Thank you, Dr. Lolojo. Chairman of the occasion, the Honorable Minister of Health, Dr. Osaje Ihadire, still on his way coming. The President, Nigeria Academy of Pharmacy, Pharmacist Prince Julius Adelusi Adelu, the Chairman, Nigerian Guild of Editors, Mr. Issa Mustafa. It is my greatest delight today to introduce the happening man, the man on every Nigerian's lip, the man who has proved beyond all reasonable doubts that with proper planning, commitment, data mining, and data management, Nigeria can contain superbly any emergency, be it health emergency, political emergency, religious emergency, economic, or even security emergency. I am talking about the highly revered keynote speaker for today's event, Dr. Chikwe Ihediozu. Dr. Ihediozu is the current and first Director General of the Nigeria Center for Disease Control, NCDC. He is an infectious disease epidemiologist and consultant in public health medicine. Before his appointment, Dr. Ihediozu was the managing partner at AP Africa, a health consultancy firm. He worked previously as co-director of the Center for Tuberculosis at the South African National Institute for Communicable Diseases, Johannesburg. He was a medical epidemiologist consultant with the United Kingdom's Health Protection Agency, as well as with the German's Robert Koch Institute. Dr. has held several consultancy roles with the World Health Organization in response to mental outbreaks and supporting the design of systems in Geneva, Sudan, Liberia, Botswana, Zimbabwe, Lesotho, Swaziland, Turkey, and now Nigeria. Ladies and gentlemen, please join me to welcome with a round of applause the man of the moment, the keynote address speaker for today's event, Dr. Chikwe Andreas Ihekwazo.
As we invite our keynote address speaker to talk to us. The DG of the Nigeria Center for Disease Control. Please talk to us, sir.
Okay, thank you, colleague. Sorry, I was cut off for a while. It's the challenges with technology as you try and combine many things. But thank you very much, colleague, for the welcome, for the kind words, and really for hosting this important meeting today. Thanks a lot to the Nigeria Academy of Pharmacy and the Nigeria Guild of Editors for the work you're doing on behalf of all of us. Grateful for the invitation. I've listened as I can for the past 20 minutes, and I think this we must also remember that this, in the global health security space, global public health space, we've been warning for years on the potential for a pandemic. But these warnings were not taken seriously by most people around the world, especially our political leadership. It sounded like science fiction. And even when we got on the cover of magazines like Time, it was still very difficult for countries to devote the thinking space, the economic resources to prepare us for events like this. Even after the 2014-15 Ebola outbreak on our own continent, yes, it led to certain critical developments, such as the development and growth of the Nigeria Center for Disease Control. Still, these were thought as, marginal activities of people that we hope never to need. And truth be told, very few people had heard about NCDC before 14 months ago. So the challenge really is, how do we as leaders make critical decisions and prioritize things that might not always be on the front pages of newspapers and in our national that we are in right now for a disease that we did not know about, or in fact did not exist 14, 15 months ago, to have cost over 2, in fact, closer to 3 million lives, going on 28 trillion by 2025, and those estimates might actually increase depending on how successful variants are against vaccines that we have at the moment. We hope that is the case. It has destroyed the livelihoods of hundreds and thousands, fractured societies, and left our whole way of life. Very few could have imagined a few months ago. And we can't say we haven't been warned in Nigeria, to be honest. We have faced a series of public health outbreaks, from Ebola to polio to meningitis, monkeypox, Lassa. But I think whenever these things happen, we think about them as things that don't bother us, the elite, or the governance structure, or the political class, or the leaders, or the academic leadership. And we think that those are small events that will happen somewhere, and some people will call WHO and will manage it, and it will go away quietly. But this time it has affected all of us in the country, rich or poor, some way, by the COVID pandemic. And I hope that then leads to some change in perspective. But let's think first a little bit about the outbreak itself, because we're by no means out of it. So we're now just over 163,000 cases with just over 2,000 deaths. So we have been spared to a large extent the worst impacts of this outbreak. And if you reflect a little bit back to where we were just over a year ago, from the emergence of this virus in China, we thought that was very far. But here at NCDC, even before we had any single case, we set up a national coronavirus preparedness group, started putting a plan together, doing a risk assessment of where our gaps are, and very quickly realizing that we were not in a good place. But we still built up very quickly. So by the 20th of February, before we had any case, we had already established testing capacity in 4 labs in Nigeria, here at NCDC, at NIMA, at Luth, and at the Africa Center for Excellence in Genomics in Ede. So by the time 27th of February, when we established our, confirmed our first case, we activated our National Emergency Operations Center, activated rapid response teams to go and support Ogun and Lagos states in their response. And since then, we've been responding to this unique event in our lifetimes, responded to an outbreak, a pandemic in every single state in Nigeria. The federal government of Nigeria really responded in a way that is unprecedented, set up a presidential task force led by the secretary to the government of the federation, very high level leadership. And credit to the Nigerian government, really let the task force lead the response and interfered as little as, very little apart from actually providing the task force the resources they needed to respond, both in terms of the response and the economic sustainability plan and everything that has been a fallout of the response, leading up to March this year, when we finally started our vaccination campaign that will hopefully take us out of the critical part of the outbreak. So I did on 6 key areas that have been critical to our response. Firstly is the use of emergency operation centers and emergency response and coordination, and how that has happened. A few years ago, we learned from the polio response and the Ebola response that rather than the slow consultative pathway to making decisions in public health, that we have to learn a little bit from the military, decisions in real time in a way to respond to emerging threats without all the evidence and the science fully in place. This is done in the context of emergency operation centers, which we have had a national one for quite a while, but we were working to increase the numbers in the states. So this response gave us the opportunity to rapidly scale up the number of EOCs. We now have an emergency operations center in a public health where everyone involved in the response comes together to make critical decisions to do next with the response. And some of our public health laboratories have been spoken about severally. You know, we started from a very low base. But once we started, we knew that laboratory diagnosis would be critical for this pandemic. So what we started doing was work with universities, work with states, and look for wherever we had some minimal laboratory capacity in the country. And then we really transit those into sustainable labs for the country, so that it has a public health lab to serve its purposes. Thirdly, let me leave risk communications to the end, because it's very important to spend some time on that. In terms of surveillance, we had a history of working a lot with paper-based and Excel-based surveillance. So we were setting up a digital surveillance platform called SARS. We had up very quickly. Infections do that because this was a new disease, and we had to really learn in real time, develop guidelines, implement those guidelines. Sometimes clinicians did what we told them, other times they didn't. So you need to go back one slide. In many parts of the country, things like ivermectin are still being used to manage patients, although it never found evidence of efficacy, together with our collaborators around the world. But you know, clinicians ultimately make some of these decisions with their patients. We developed a national logistics and supply chain system, making sure that commodities are distributed throughout the country. And you would have noticed, everyone would have noticed that there has not been any major story in any of our papers or media houses on the stock out of PPEs or stock out of reagents since the beginning of the response. So that really is indicative of the good work that has happened in making sure the country is really covered with the commodities that they needed for the response. The last point I wanted to talk about was risk communication, because unlike everything else here, a lot of what we do is dependent on us. In risk comms, it really depends on how we can build trust in a population to do the things that we need people to do, to keep their distance from each other, to wash their hands, to wear masks. Institution could do. This is what people had to do themselves. So the decision of an individual on adhering to the public health principles that we advocate really depends a lot on the trust that they have on the messages that we provide. And this is not something we can do on our own. We knew we couldn't. So we had to continuously develop these messages, share them, but use whatever mechanisms that we have to build trust with people. And I think we ultimately did a fair job, but in the beginning of the outbreak, we didn't really do enough in ensuring that we use the diversity of resources available to us as a country, use as many voices outside government institutions to share those messages. We learned those halfway, and it became much better implemented later in the response. So as we have responded, we have managed this outbreak. I think many people will judge our response as a country fairly complementary. But we are also very aware that a lot of factors have played into this. Yes, we've been spared from a catastrophic pandemic. Many people still have lost their lives, and we have a responsibility as a country to make sure that we are better prepared in the future. And this has been mentioned already, and we have to build back better in order to not be in the position that we were this year, scratching around for commodities, scratching around for labs, doing things for the first time ever. So that is really the focus of the response at the moment. And where are we with that? Firstly, as I said earlier, we started from a very low base in terms of our laboratory infrastructure, and we have really focused very aggressively on that, and now have labs in all the 37 states in the country, molecular labs, and we're working very hard to sustain this, to make sure they have the supply chain, the equipment, the human resource to sustain the work that they're doing. And this is very much a work in progress, and we know that this is not something that we can do overnight. But if you look at the laboratory network right now, I think every Nigerian will be proud of where we are. The fact that we're not sending samples across the country for testing. In every state, we have the infrastructure to test locally, but we're now working to make sure we support this, that if you need a bioengineer to fix a PCR equipment in Sokoto State, that we can provide that support locally in Bayelsa, in Adamawa, and making sure the supply chain around of this. The next area I spoke about earlier was on our surveillance system. So prior to 2020, we had only 17 states covered in our ability to do a case-based digital surveillance across the country. So right now we have so much work. Very happy that this data is flowing not only for COVID, but really for all the other infectious diseases that we're now gradually adding onto the system. So this is working well. We need to make sure that everything on internet access is dependent on some hardware, and that we're supporting the states, but also advocating for every state to make sure they make the investments required for these to work consistently across the states. The third area is on emergency operation centers. Again, we had this already in 29 states, and now we have 35 states have their own EOCs, and these are within the state's own public health infrastructure. So in each of these states, we now have an EOC where critical decisions are made around any public health issue, whether it's COVID, polio, or whatever other outbreak that they are facing. Another big area that has required a lot of work is on infection prevention and control. This is how healthcare workers prevent infections. And if you look at our data very closely, this is something that many people in this room will be interested in. Is how have many of our infections have happened within our healthcare work from the infection itself. So we've really worked very hard to train our healthcare workers physically. We've produced online videos that have been accessed thousands of times, training opportunities around IPC. And this is an area that we hope to transform completely as we move forward. So this is not somewhere we hope to go back to the old normal. We hope to create a whole new normal around IPC so that patients and doctors and nurses and pharmacists, medical laboratory scientists, everyone working in a hospital settings are safe to work in the context where they're providing care for others. The next area is on risk communications. We've taken this very seriously. Our website is one of the most accessed websites in the country. As we release our data every single night, our guidelines are used by people across Africa and beyond. We've done more TV appearances to share this message than any time in our past. We've responded to rumors, whether they're rumors on chloroquine, whatever propaganda is out there about different interventions. We've made sure we always insisted on the science being at the front of the response and using different techniques to make sure we communicate this to Nigerians. The next area is on the science itself. We realized in the past that proactive in sharing the knowledge that we are generating with the rest of the world. So we took a decision very early that as much as the response itself is our priority, we have to document what we're doing and share it in peer-reviewed publication. Make sure that this is being, we are contributing to the science. So we've done this, carried out studies, the seroprevalence survey. The report is about to come out. We already announced some initial preliminary results. We have 20 manuscripts about the response in various stages of production. If you go to PubMed and search, you'll find 6 manuscripts already published describing the outbreak in Nigeria and various parts of the response, documenting lessons learned and using science, how we've used science to guide our response in Nigeria. So now, as I begin to conclude, what are the critical thoughts out of this, especially for this setting and this meeting? We cannot do this on our own. In fact, the entirety of government cannot do this on its own. And what we've learned is that strong collaboration is absolutely necessary for the response now and in the future. And we have seen the private sector come together through COVID. We've seen the UN come together through the UN Basket Fund. So collaboration is critical in our collective ability to prevent, detect, and respond to infectious disease threats now and in the future. What we want to do at NCDC is be the center that pulls all of this together on behalf of the country. So the Nigeria Center currently has 3 campuses in Lagos, in Abuja, 2 in Abuja and 1 in Lagos. Our mandate is to prevent, detect, and control diseases, coordinate the surveillance, support states in responding, develop a lab network, synthesize information, and use it to support government in making critical control decisions. So what we've done is bring in all these various public health responsibilities. It's not that they didn't exist before NCDC was created, but they existed in various other departments, directorates, agencies all over the system. So what we've done is pull all of this together into one institution that then has the mandate to collaborate with others in order to deliver on the response for the country. So my final thoughts are how moving forward. One of the critical areas for us is on antimicrobial resistance. In fact, this is thought about as one of the biggest public health threats for the next 20 to 30 years and maybe beyond, because it is complex. It is not a single disease like we're used to working. It will require, by definition, working with the animal health side of things, with agriculture, with industry, with pharmacists. So we have to really find ways of working together around antimicrobial resistance. We need to work together, database in advanced countries, purchasing distribution data for medicines ties into the disease surveillance for those countries. So as we need to collect more dispensing data and find ways of using all of this data to understand what is a new public health threat and how to respond to it. And we need to work together to share the information with our different stakeholders, and make sure that we can influence public policy decisions. Very often we say, what is government doing? But government only does largely what people are expecting them to do. So we all have our professional voices. You have your professional voice. So we're asking you to use it a lot more in pushing government in the right direction with the right evidence moving forward. In terms of a few more specifics, we've come up with an antimicrobial national action plan for antimicrobial resistance that has 5 focus areas of intervention. And I'm not going to read out any of these, but I wanted to leave them just as ideas on things that pharmacists can contribute, other professionals can contribute towards the National Action Plan. It can be government funded, but other your professional associations are saying this do. And then it is also in the National Action Plan for AMR. So we have identified it as a priority. Any professional group can then pick up that priority, raise funds, or get your own parent companies if you're working addressing priority areas that will be included as a priority deficit or a priority objective within the National Action Plan on antimicrobial resistance. So this is just an example of where we as a National Public Health Institute have done some background work, set out what we think are the priorities for the country, and now really expect all the professionals to come in place, whether you're a pharmacist or whether you're an editor, to think about ideas on how to take any of these balls to run with them. So to conclude, the world is changing, and sometimes it's not changing in obvious ways. There's increasing migration to cities, the climate is changing, there's increased travel, our public health systems are more fragile than ever before. There's no doubt about it. The old public health order that we all imagine appropriate for today. Also, the opportunities for intervention have changed a lot. We have to work across professions. We have to bring in a lot more social science, understanding our environment, understanding medicines, and really thinking about how to communicate all of this to an increasingly skeptical public around government institutions. So how can we do this? Of vertical programs working in bubbles to really effective collaboration across professions, across public and private, across government and international organizations, to make sure that our world is much more resilient for the emergence of a new outbreak. Because the fact is that infectious diseases are much smarter. There will be new viruses and bacteria emerging. What will be different is our ability to find it early, respond locally, and prevent extensive spread from that small cluster happening to becoming a global pandemic. We failed as a world to do this in 2020. The challenge for all of us in the future is will we fail again to do it? And in order to improve our capabilities of doing this, we will continue improving our capabilities within NCDC, but we need a much stronger collaboration across professions. Some of these thoughts with you and really open my arms out to you to invite you in and invite us to you, and hope that we can together build a much more resilient country for all of us. So thank you very much.
Oh, round of applause for our keynote speaker, Dr. Chikwe Ekwazu. Thank you very much, sir. We appreciate you. You see, when this thing started and you were all guests of CNN and all other international news, there's a gentleman, Dr. Fossey, always on the news. answering questions, moving around. Sir, you are our own Dr. Fossil. So we will still be calling you all our doubts. In fact, we are working for you because the questions that people are asking us, those doubts that they express, particularly those who are talking about the vaccines and all the things, they are all Dr. Ekwazo's questions. And we've been trying to respond on your behalf. But we thought it fit that we need to bring you for the Nigerians to ask you these questions. And I can tell you, sir, so many questions are already lined up for you. We will plead with you to please stay with us so that we just go through the panel discussion, then we can come back to you for you to answer or respond to those questions. So at this point, I want to be calling on Professor Moses Akamu, the Dean of Faculty of Pharmacy, Obafemi Awolowo University, to please introduce our panelists and the moderator for the day. Professor Akamu, please.
Thank you very much, sir. I want to thank
I know
the
you're a very
organizer
brief man,
of this program.
so make it brief.
And at the same time, thank you very much. I will do that, sir. I want to thank the chairman of the occasion, the
I think our dear prof is having some challenge with network. We cannot take all the benefits without taking some of these challenges that we have.
And the founder of Pharma Plus of Nigeria Limited. So that's our moderator, the immediate PS. The other panelists, we have Professor Ellen Wanat, Committee on COVID-19, the Secretary General of West African Postgraduate College of Pharmacists, and a Professor of Pharmacology of University of Jos. Other panelists are Dr. Jimmy Arigbabuwo, the former chairman, Lagos chapter of Association of the General and Private Medical Practitioner Nigeria, and the current president of Healthcare Providers Association of Nigeria. We also have Mr. Issa Mustafa, the current and Bear TV and Redeems 93.7 FM. And I want to say these are all the panelist members and the moderators. And I believe that they are ready to give more information to us on COVID-19, the facts and the myths. Thank you very much.
Applause for Professor Moses Akamu. Thank you very much for the brief introduction. Let me now hand over to the moderator of the day, Alhaji Ahmed I. Yakasai, immediate past president, Pharmaceutical Society of Nigeria. Alhaji Yakasai, please. Alhaji Yakasai. Is he not in the house? Oh, wow. It appears he has gone off. Okay. Okay. I will try to sit in for him on this platform because we were expecting that it will be around here. Our panelists have been introduced. We have Professor N.N. Wanang. We have the President of Nigeria Guild of Editors, Mr. Isa Mustafa, who had been around since morning. And seated with us here is Dr. Jimmy Arigbabuwo, the current President of Healthcare Providers Association of Nigeria. Our time is very short, but I will call on each one of them to give us a 5-minute presentation to start with. We have I've requested, and they have all obliged their address. This we are going to use when we are compiling our report, because time may not permit for them to give us everything that they may want to give us. So let me start with Professor Wanang, Professor N.N. Wanang. Speak to us on this subject.
Hello. Hello. Lulu.
Oh, my good friend, you are welcome.
Thank you very much.
Where have you been?
My internet disconnected.
Oh, a whole IPP. We are going to sue them.
Yes, I don't know what happened.
Okay, so please go ahead.
Thank you very much. Oh, you have invited me already?
I was almost doing it for you, and I got to the stage of calling Professor Wanang to give his 5 minutes address. So please.
No, you can't do that. Thank you very much.
The floor is yours. The floor is yours.
Thank you very much. Thank you. Good morning. My name is Pharmacist Ahmed Yakase, MNI, and the immediate first president of the Pharmaceutical Society of Nigeria. I'm the moderator of this first session, which we are going to talk on COVID, facts, myths, and the way forward. And before we start the discussion, I want to give the rules that every speaker will spend 5 minutes, but for the first part of it, the speaker will spend 3 minutes, and then we'll go around to all the 3 speakers, then come back for 2 minutes, then question and answers. There are some burning questions on all our minds. Everybody is thinking of the facts, the myths, what is the way forward? And we know so many people are asking, are the vaccines safe? Are they going to give coronavirus when you are injected or you are vaccinated? Can you get, will it cause infertility? And then any side effect and so on. So the myths, so many people believe the vaccines are being developed so quickly, and will it give the natural immunity? So we're going to look at the whole concept of COVID virus infection vis-a-vis the development of the vaccine itself. And I have the pleasure to introduce the speakers. One is Professor Wanang, who is the Secretary General of West African Postgraduate College of Pharmacists and aspiring Vice Chancellor, University of Jos. May God give you. Then the second one is Dr. Jimmy Ade Arigbabuwo, and the last, not the least, Dr. or Professor Isa Mustafa, the Nigerian Guild of Editors. And I want to start by asking Professor Wanang if he's around. Wanang, are you there?
I'm here, sir.
Thank you very much.
Well, thank you very much, sir. I actually prepared a PowerPoint thinking that I was going to spend about 10-20 minutes on it. But since you have given me 5 minutes, let me quickly have a discussion without the PowerPoint. However, the PowerPoint is already sent so that we can have a look at it.
Why people are doubting the science of the disease? Even the not.
Hello, sir. Can I continue?
Yes, you have 3 minutes.
Yo, thank you very much, sir. I appreciate the Napharm for this organization if there's anything that has really suffered a lot of controversy, it is the corona or the COVID-19. Incidentally, I am a victim of COVID-19. I'm also a victor of COVID-19. A victim because I contracted this disease myself in the course of my work and one or two things, and a victor because I was able to defeat it. I came out victorious out of it. So many controversies. Some are saying it is harmless. Some are saying there's nothing like that. But all these things are just fallacies. As a matter of fact, the disease exists. It is a zoonotic disease. So many people have died out of it. You've had a lot of statistics from there. But let me quickly jump into the vaccine and then the safety of the vaccine. Unlike conventional vaccines, whereby the vaccine could be produced from dead or attenuated or weakened antigens so that it provokes the body to produce antibodies to combat. This is not a conventional vaccine. This one, the system is trained to produce, produce an immunity against a potential threat. And that explains why this vaccine is different.
Hello, Wanak, are you there? Hello?
I mean, it's going to be harmful to people. I'm optimistic on the safety and the efficacy of this vaccine. The caveat is most likely on the financial and the political support. So many persons are looking at it from the area that the pharmaceutical industries are looking for money, and then the political aspect.
Hello? Hello? Hello, Wanak. So if we are missing Wanang can join later. Can I get Dr. Adeye? Adeye, are you in the room?
Sorry, network sent me out.
Yes, let's get Dr. Adeye. We'll come back to you, Professor Wanang.
Thank you, sir.
Thank you very much.
Dr. Adeye. Yes, Dr. Adeye, are you there?
Moderator.
Yes, you are welcome.
Thank you.
So I want to know the initial challenges faced in the clinical setting when we had the issue. And then, of course, were these challenges met? Any problem? And then why so many deaths recorded in Europe, America, not so in Nigeria? Can you carry on?
Yes, thank you very much. Because of the novelty of the virus, the initial challenge we faced as foot soldiers happened to be from the patients we're seeing, everybody became a suspect. We're not too sure of the clinical presenting symptoms and signs that really looked similar. We're not too sure of how we're going to protect ourselves because of the novelty of the virus. And again, because it resembled so many other common diseases in tropical Africa, for example, we were at a level where we needed to start working on empirical formula that is bearing symptomatic. Then there were these doubts. Even amongst practitioners, we began to wonder, what type of virus would this be? And apart from that, no specific treatment regimen. And it was like you needed to approach it symptomatically. And again, we began to also wonder, this social distancing, hand wash, and other steps in infectious diseases became a case of burden for most practitioners. What will be the cost of your seeing one patient in protecting yourself alone will have even overshadowed the cost of treatment. So we all became worried. And education, advocacy, and synergy, meetings upon meetings. And how will even the meetings be? We could not do physical contacting. So invariably, issues of webinar and the like, teleconferencing, all of that came up. And again, we looked at it. Was it sex bias? The answer was no. Temperature inclined? The answer to this, no. Age? Yes, initially we said age. By the time the other waves also came, we found out that the young were dying the way the elderly were dying. So we all became worried again, what type of things we were really looking at. But by and large, conspiracy theory and other things also followed. And we began to wonder, was it an attempt to reduce population, Caucasians own or the black own? And indeed, at the end of the day, we found out that science, real science, will be our exit channel. And that is to say that irrespective of the taboos or the formulas we might be thinking of, we needed to look at the scientific aspect and work accordingly. So the NCDC became a body to rely on. Our own science we learned even from secondary school, even in the university, we had to reapply them. Oh, the receptor site, oh, what would hydroxychloroquine do? What were some of these drugs doing, including even the recent ivermectin, the mectisan, that we know was antiparasitic, introduced in the 80s. So all these worries, we began to ask ourselves, is it antivirus? Is this antiparasitic? So is this organism really anything to talk about? Then the vaccine issue quickly came up. We now began to ask ourselves questions again. The criteria that passed an agent for a real true vaccine were not really identifiable with the vaccines we are seeing around, whether the attenuated way we needed to see it, make a virus to become attenuated and see what. So our pharmacist became the next set of people we needed to knock on their door. What exactly is going on? And will we say this vaccine is really a vaccine or a therapeutic agent that's just meant to treat? But even if it's treating, to what extent would this be? And the mRNA, messenger RNA, and DNA issue also came up. Oh, genetic mutation will come up. Somebody's genetic life will be changed again later. We now started education upon education. Educating the educated became an issue again.
Okay, Dr. Adeye, I will knock your door. You will continue educating the educated ones. Thank you very much. Let's move to the journalists. Yes.
Thank you.
Thank you very much. Mustafa Isa, the journalist, the President Nigerian Guild of Editors. You know, journalism is very important. Without journalism, the world will be ignorant. And we want you, I know you have gone around the society, what they have been saying about COVID-19. I want you to share the myth, what people, the society, they have been talking about the COVID-19. And indeed, again, the confidence, you must have interacted with scientists to find out why are they opposing some of the notorious scientists, why are they opposing the belief that there is COVID-19? And then the response, we have heard what the NCDC said, what they have been doing in terms of giving information to the public. Is it adequate? Are you happy with that one? Yes, Dr. Isa Mustafa. Hello, Mustafa Isa. Hello?
Mr. Mustafa, you are in the house.
Have we lost him?
He's here, but I don't know, but there seems to be no activity on his, but he's here.
Network, just like me, baby, can be crazy. So maybe we'll quarantine his 5 minutes. I will go back to Professor Wanang.
Azu, where's the president?
Hello, Professor Wanang. Wanang, are you there?
I'm there. I lost their back.
It's okay. So I want to take your 2 minutes now.
Okay, sir.
Oh, Dr. Lulu, any room for audience to ask questions or only chat room?
But once
Hello,
you
Lolu.
finish this, you can, anybody who wants to ask questions can.
It's
Let
okay.
them finish their 2
So
minutes.
it's okay. Professor Wanang,
Yes, sir.
from the Scientific Fund for Bill, what have we learned as a medical pharmaceutical community and the nation, and how do we prevent the future occurrence so that we will not allow something like this to come to Nigeria?
Well, let me start with the way forward. The way forward here is for us to pick the errors that had happened in the past. I know that the country did not prepare much on such a pandemic. Unfortunately, we didn't learn from Ebola when it came, and the same mistake is repeated. Probably if there is, may God forbid, COVID-25, maybe in 2025, we should be able to make adequate arrangements to prevent. Now, what we should do is to encourage indigenous research. We should be able to work on human capacity, and government should deliberately and consciously fund all research centers and make deliberate policies so that if there is any occurrence of that, we should be able to know the line of action that we are to take. Most importantly, the media should also be involved deeply so that they can conscientize the people. They should be able to educate the people. Most fundamental, government commitment is needed so that we can have a structure on ground to arrange the health, the research involved in all the universities, researchers in the industries, and bring them together in a single pot for a bigger and a better tomorrow. If we are enjoying the science today of the vaccines, it's because some other persons in some other countries did not sleep. They had a structure that was well laid down, and we should be able to borrow from there so that we can have progress for our system. We've learned, actually, that our healthcare system is in shambles. Our research environment is pathetic. So these are structures for us that will make us look at the past so that we can adjust for a better tomorrow. Thank you, sir.
Thank you very much. I can see Mustafa is back. Okay. Dr. Ade. Dr. Ade, are you there, Jimmy?
Thank you, Ahmed, my good friend. I'm in house.
Dr. Jimmy Ade.
Yes, I'm in house. I'm at 2 minutes now.
No, I'll give you your 2 minutes now. Why people are still hesitant about the vaccine? Why? Why they don't want to take vaccines when they know it is safe? People have been saying it is safe. People like you, pharmacists, lab scientists, they said vaccines are safe. Why are they hesitant? And then, as you have heard what Professor Wanang said, our healthcare is in shambles. How do we go forward for a better outcome? How do we now have a health system that can cope with emergencies of this nature? As you are healthcare providers, President, you have a lot of money there in your kitty. How do we solve the problem for healthcare system in Nigeria? Go ahead.
Thank you very much. I think I'll quickly spend 1 minute on each. So the origin of the pandemic actually paved way for the conspiracy theory. We don't want to go into that, but we became suspicious of international politics. And everybody became suspicious even of his neighbor. So when the vaccine now came in, the question is, if we said they were trying to reduce our population, they were also bringing vaccine, but is there not really going to be international conspiracy? So you see, and the people needed education. That's like I mentioned before. So we needed to just educate ourselves that we have to survive. We don't have to die. Now that is one area. So unlike other vaccines we have had in the past, the resistance against this one was much more than ever. And again, look at the dosages that were brought in, probably by 3 million plus for 200 million people. And only public sector, private sector is not yet included to participate. So, and I think the worry is also there. When are we bringing in the private sector to participate? We were worried initially about testing for COVID-19. Later, after some time, we brought in private sector. We can quickly think of it also this time around and bring them on board. Number two, the health system in Nigeria is, I wouldn't want to use a very lousy language, but we shouldn't deceive ourselves. We are in some level of shambles. And because we could not fix our health system, it became extremely difficult for us, for example, to say, oh, we had good budgetary allocation for health. We are still roving between 3 and 5%. Abuja declaration was about 15%, some years ago, about 2010 or so to say. Where are we today, and why are we here? Do we need to politicize health budget? The answer is no. Our health insurance, at what level is it? In fact, it's at the bottom level. We are still just at nonsense level we're introducing. So the way it is, we need to face health budgetary allocation very well, not politicize it. Fix our health system. We have pharmacists, Yakasai, that is there for us. You are a specialist, you are an expert in your field. There are many doctors out there, lab scientists out there. We are experts operating in an environment that's not conducive to practice. Our technology for practice is just below international standard. And because of this, everybody still gets involved in medical tourism, which should not be. So our system, we need to go and fix it. And that will start from leadership with an example. And we who are the experts that we say we are around here, it is time for us, we began to think of how we will manufacture our own vaccine. If his vaccine is Nigeria made, and Ahmed and other people who are there, who are our friends who participated, even me at my level, being a specialist family physician, I will not be suspicious of anybody. I will know that it is homemade and it's also for us and for all. So the way it is, we are gradually going to bail ourselves out of what some people have described as slavery. So if we do homemade good, homemade material, patronize our own pharmacists here, you can do it, you can make it. Let us all collaborate and work in synergy. When that is done, if you serve me Gary, I will not be afraid of taking it. Thank you.
Thank you, Dr. Adeyi. Have you done your vaccination?
Hello, sir. Are you with me?
You have been vaccinated.
You
have been vaccinated,
I have to show example so that other people can follow.
Thank you.
We're educating others, so I must show example. Thank you.
Thank you very much. Dr. Isa Mustafa, are you there? The journalist. He's here on my screen. I don't know where he has gone to. Dr. Mustafa Isa.
Maybe it's network problem where he is. Otherwise, it's listed here.
He has been there since the whole time.
I think he's speaking.
Hello. Mustafa Isa had a problem with his connection.
Okay. Oh, it's okay. So we go into the chat room now and ask questions.
It's all right.
So that the two can handle. So I want to really thank Professor Wanang and Dr. Adeyi and even Isa for his own interest to be there. This is a very rich debate. I know if we give you time, you will spend the whole day here. But I know you have been the chairman, Wanang, you have been the chairman of Plateau State COVID-19 pandemic. You are doing a good job. But we'll allow the audience to ask questions through the chat room. And I think Lolo Ojo will handle the questions from the chat room. Do you have questions from the chat room?
Yes, Mr. Moderator, sir, we have. I think our moderator and the panelists deserve a round of applause from all of us. Round of applause. Good job that they have done. I think we'll take them one by one. I actually thought that our keynote speaker will stay around with us, but I think he has gone. And we got a message as an emergency that needs to be attended to. But thank God we have Professor Wanang and we have Dr. Arigbabu in the house. I'll pick them one by one. And the first one is from Blessing Chukukelu. I'm concerned about the safety profile of the vaccine. Is there a reservation of the present AZ vaccine for second dose vaccination? How do we ensure that the cold chain is maintained down to local government level till administration? Professor Wanang, that should be for you because you are in charge in Plateau State. Concern for safety profile. Are we sure that we are going to have enough of AstraZeneca vaccine for second vaccination? Then how do we handle the cold chain? That this is maintained in the rural areas, local government level, till they administer. Professor Wanang. Please.
Thank you very much, sir. First of all, the efficacy and the safety of the vaccine is not in doubt. it is documented that it's about 97% safe. There is no drug that can give you an absolute 100%. There's no drug that cannot or does not even have side effects. So for the vaccines to have mild side effects that are reported is the normalcy. But I can tell you, researches are ongoing still on the vaccine, on the development, on the drug, changes or whatever that happens. But so far, we have a very reasonable and substantial percentage of safety on this vaccine. On the cold chain, that's going to be a huge problem for us here in Nigeria, coupled with the fact that power itself is a problem. That is why I say the health facilities in this country is actually unfortunate. I'm happy that the policymakers are listening. For us to maintain this vaccine, there must be also the maintenance of the cold chain. It's going to be a huge challenge. I think government should be able to be up and doing so that they can provide the facilities to maintain that. Then the question on the second dose, the availability again, I think it's more of a government policy. They must be able to do that because it has been documented that some persons can have the first dose, the second dose, and the third. But instances are bound whereby if you have the first dose without the second and third, there's another controversy again. Some researchers are saying it is going to give about, it has submitted about, I think, 13 or 16% of COVID positive tests. That's the irony.
Yeah. Okay. Professor Wanang, thank you so much. For us to move fast, I will take two questions at the same time. And
I know that government should be able to have made a lot of things.
Have you finished? Okay, yeah.
Go ahead, Lolo.
Okay, thank you. I will take two questions. One from Dabota. From Dabota, is there any documents or publication of the number of health workers, especially doctors, that have been infected with COVID-19 and the outcome? Another one from Amino Zakari. Why are we not conducting antibody tests to understand the rate of asymptomatic infections, and for those that are suspected, that they suspect that they have COVID-19? Dr. Adibabu, please answer that. Do we have documents, publication on the number of health workers affected?
Thank you very much. The reporting, especially at the community level, where there is community infection, the reporting of death have been adversarial. Let me just be emphatic, because we are on the field. There were some deaths that will not be recorded. There were some deaths that occurred whose cause, for example, or which cause, for example, was not even determined, but suspiciously, we knew it could be COVID. And because of that, we saw good number of doctors, pharmacists, nurses, who have died as frontline soldiers from this particular pandemic. And because we are the first line of call, so to say, and at the association level, yes, we were collating our own figures and passing them around to say this is what we collated. And we needed to match that with the NCDC figures as well. So I think we're not going to pronounce anything unless what we have from NCDC, for example. That is what becomes authentic as the figure. But I must also let us know that as far as the issue of the death, well, second question, sir.
We are asking for why are we not conducting antibody tests?
Thank you.
To understand the rate of
Thank you. Yes, as we are, two types of tests we saw. Okay, the antigen and the antibody. One will show at least somebody had probably had a mild infection before and had gotten rid of it, so to say. We say, okay, we had developed some antibodies, and then the antigen came up. Now, we were at the beginning even encouraging and suggesting that we should be doing this rapid diagnostic test to come on board. But because of suspicion also, how accurate would that be? How sincere will people be? Will some people not bring in fake test kits? And will the results be that reliable? Are we sincere? Are we going to be sure of what we are getting? Those were the initial challenges we were faced with. And then going to the polymerase test, for example, the private sector that were allowed to conduct, it could be as costly as 50,400 naira, for example, per head. So even the so-called rapid diagnostic test, some people started making it a kind of business-like syndrome, and it can be very worrisome in public health. How many people can afford the 50,000 for, number one? And then the antibody we are talking about, how sincere, what will be the source of what we are getting? How can we centralize it? How can we harmonize? And are we not going to be getting deceived and getting confused and confusing with the general public? So, but I think a well-structured public-private partnership that is well monitored. For example, we give the answer. Look at it. Initially, we said nobody will do COVID-19 screening or testing except the government centers. When it became overstretched, we now say, okay, let's have a structured private sector that will be accredited to do it. And they are doing even till today. COVID-19 treatment center. Initially, we say, oh, no private sector should treat. No private sector will treat. Today, we have accredited private sectors treating because of overstretched phenomenon. One thing is clear to us. Yes, oxygen is needed. It's a common denominator. We need to build immunity, common denominator. These are the issues we need to work on and then bring in the private sector to partner with the public sector. Until we have this to work with us, I can tell you what is on ground now can be overwhelming for government. Government cannot do it alone. In a country where 70% of the health needs of the people are based on private sector provision, for example. So no matter how we look at it, we are still the grassroots people. So we really need to do a PPP that's going to work well to help us to get to our destination. Thank you.
Thank you so much, Dr. Arigbabuwo. The next set of questions will go to Professor Wanang. And this one is from gentleman Inabrian Spiff. How reliable are the figures we are seeing of the positive cases? Are these figures true reflection of infectivity rate right now in the country? That's number one. How reliable are the figures, and can we confidently say the figures reflect infectivity rate in the country? Another one from Michael Okafor. Maybe I should have thrown this to Dr. Arigbabuwo anyway, but it's meant for the NCDC DG. But I put it on the table to be answered. He said, I had expected, with the wide footprint of community pharmacies, that NCDC will leverage on this capital to drive public health response in collaboration with the National Primary Health Care Centers in issue of vaccination and the like. If this is being done in other countries, why? What is the matter in Nigeria? Why are we not doing it? So, Professor Wanang, please speak to this, and Dr. Arigbabuwo will be ready to speak to it. Thank you.
Thank you, sir. Well, on the reliability of the figures we are seeing, I can tell you that the source is reliable because the NCDC is a reliable source. It collates from the state level, and then it brings them together to form what we have in Nigeria. The source is reliable, so I can absolutely tell you that the figures you are seeing on the cases, the infection, and then the death. Are very reliable, no doubt about that. I equally contracted the same thing. Then on, hello?
Yes, we are hearing you. We are hearing you, Professor Wanang.
On the issue of, I think it's better for us, if we really want the distribution to go around, I will advise that government should consciously, or policymakers should consciously bring in pharmacy or community pharmacy into the distribution of this vaccine. It is done in the US. It is not going to be sacrosanct that only a particular sex should be able to do this administration. In the United States, in developed nations, they distribute these vaccines to community pharmacies because they are always the first point of call to patients. And the advice I would give to federal government is to look into that so that we can have an easier access to these drugs. If it is so, to this vaccine, if it is so, we're sure that we're going to have a very wide and reasonable coverage of the vaccination. Thank you.
Thank you so much. Please let me assure everybody that there is no question that will not be answered. Today is just the beginning. Tomorrow we are coming, next tomorrow we are coming. So if we are unable to take your question now, we certainly will take them later. Some of it will send to the DG of NCDC. It will provide answers for us and we will bring it to you. But let me just ask a few more, then we can close the session for today. I return to Dr. Arigbabuwo. Somebody asked, and that is Dafo Stephen. Say, what are we doing to improve the Madagascar experience? And in fact, somebody is asking Plateau State, what Plateau State is doing, learning from the AstraZeneca achievement. That is okay, you have spoken to us very well about AstraZeneca vaccine, and you are the head of the Plateau State effort on COVID-19. What are you doing to give us, what are we going to call it? Just Plateau vaccine or something like that. But let Dr. Arigbabuwo answer the Madagascar one first.
Thank you very much. We were also confronted with this question of, will anything good or great come out of Nazareth? And people began to wonder if the solution will come from the black, if it's going to come from Africa, will it be globally embraced? And the time will prove, so we said. But when you go to UK, go to America, go to Asia, no matter any of these continents we go into, we discover that Nigerians are foremost, even as far as healthcare system is concerned. We have professionals in the diaspora who are very good and very sound. All we need, or we needed all along, is the conducive environment. So, be it Madagascar formula, whatever way it is, a question that is still big, which some of us are begging, but we're still scientifically going to join in the research, is the fact that the present vaccine that we are using, we seeing the vaccine as totally carrying the criteria of a classical or typical vaccine. The question of messenger RNA distorting DNA later, even scientists among us are also putting it on debate. And because of that, we all need to sit down, because thalidomide issue was brought up later, to say, okay, the time for the development of vaccine administration was too short, within 1 year. And that things we are seeing now, or we are not seeing now, we may see them later in future. And began to say, okay, it was because the time was too short. But I think it's better to have the vaccine than to die. That is just one area we should look at. Because something is going to kill you, something says, no, you are going to be alive, though you can have some injuries. It's better you nurse the injury while you are still alive than just go away and not be a participant again. And that is what we tell people, drop the conspiracy theory, drop everything, let's just go ahead and stay alive. So the Madagascar thing, if you had the president of that country at the time, he was saying, oh, look, because it was from Africa, they might not, people might not embrace it. But the truth remains, whatever scientifically is proven, whatever is evidence-based, I know the scientists we have, I know the pharmacists we have, I know the doctors we have, the lab scientists we have. We are very good specialists in this country, Nigeria, for example. And so we can do our homegrown things. Why don't we think of something that will even be peculiar, that will originate from us? Why are we always waiting? And because we're waiting, we didn't start the rapid test on time. We didn't even involve the private sector on time because we're waiting. So we shouldn't be copying all of the time. We should do things that are peculiar to us as a nation. Do it as fast as possible, not when mortality has become so high. And then we now begin to say, oh, we started 6 months ago. And that kind of thing. And that is exactly what we should be looking at, the level we are now. All the various groups in the health sector should now collaborate, should put up synergy, like this academy has put up now. That is how we should do it. We should all be collaborating. Government should not see itself competing with the private sector. Instead of competing, we should be collaborating. Nobody is doing competition to take trophy. What we want to see is the exit of coronavirus. And that is how it should be. Thank you.
Thank you very much. Professor Wanan, before you talk, I want you to take these two questions alongside the concern on Plateau State. Are we going to get Plateau Jos vaccine? Since you talk so much about AstraZeneca, people want to hear from you. When are we getting the one from Jos? But please take these two questions along with it. What's your position on people who are glucose D-phosphate deficient? What's the guarantee that they will not come out with serious adverse reaction? That's one. The final one is from Mohammed Kabir. That one is from Oluwafunke Awokweba. This one is from Mohammed Kabir. He said, what are the modalities for young researchers, pharmacists, whatever profession they have, for collaborative work in hospitals and universities, given the peculiar situation in our environment, that the facilities they need, the environment they need are not there. So what is being put in place so that we can tap into their brain? So Professor Wanan, quickly, we have two more questions that Dr. Arigbabuwo will answer. before we finish the day.
Thank you very much, sir. Let me start with the Plateau State research team. And right up from what the other panelists say, it is very unfortunate that we don't really respect our own, we don't appreciate our own in this country. There's a saying that goes this: nobody makes you inferior without your consent. I must admit that we believe that nothing good can come out of Africa. During the Madagascar saga, a lot of persons were saying, how can Madagascar come and say that they have a drug like that and all that? That also snowballed into the Plateau State team coming up with our own, and we have done exceptional. We have 3 drugs that were formulated, but it is not a vaccine. It is actually for treatment, and we have one that is preventive. For now, we are waiting for NAFDAC documentation to conclude, and then we'll now push it to the market. But we have concluded preclinical trials on that. We have done the pilot study on pieces 1 and 2. So we are ready really to send it out. If you look at the vaccines that are available, there's actually one vaccine from Canada by Medicago. That is a plant-based vaccine. There's also another one in Japan, plant particle-based COVID vaccine. They are working on plants. And all these things, if you look at the plant availability in Nigeria, you will now see that, permit me to use the word, we're a wasteful nation. If we can invest, if we can harness all the academia, people in the universities, the researchers, bring them together, like what the last question says, a collaboration, and then equip our laboratories. We have the potentials, we have the human capacity in this country. The people that are making waves outside Nigeria are Nigerians. Go to the US, even the mRNA vaccine that we're discussing about. A Nigerian was very prominent in Pfizer that made this development. If that Nigerian was in this country today, he would have been wasted like any other person. In fact, we have the capacity, we have the facility, we have the human capacity, but the facilities are not available. The encouragement is not there. The motivation is not there. Government is not doing enough to equip our labs, to motivate our researchers. And most importantly, they have not been able to also fund our research facilities. On the plateau, in the next, most likely before the middle of this year, I can assure you, NAFDAC will give us the nudge so that our drugs can be out. Then the question on glucose D-phosphate deficiency. I don't have much information about glucose D-phosphate deficiency and the vaccine. But looking at the science behind it, I could rightly say that most patients, most people that have this deficiency sometimes do not present symptoms. So it is possible that they will not have symptoms of the vaccines, the side effects of the vaccines that we are seeing. I think that's my response on that, sir.
Wanang, when you become Vice Chancellor, please don't forget your responsibility as a researcher. Because
I will definitely not, sir.
Yes, it's not working. Okay.
You see.
Hello, Lulu. Hello.
Okay. Okay, I have the microphone now. 2 questions for Dr. Arigbabuwo in 2 minutes. I would like to understand the vaccination plan from CDC, DG. Was the plan followed? If not, what can be done to improve? How many frontline workers or elderly still need to be vaccinated? Where can we get this data? Then the final one, what is the plan to handle concerns of blood clot in the vulnerable population in Nigeria?
Thank you so much. When the rollout of the vaccine came on board, the people who are going to be beneficiaries, they were spelled out. But it became a question of a two-edged sword. There were those ready and anxious to take the vaccine. There were those the vaccines were meant for, who were hesitant, not prepared to take. So there was now an overlap of those who were not listed primarily as beneficiaries of that first course rollout to take the vaccine. So we now had what one would best describe, because I, even as one person, needed to be moving from one local government to the other to monitor what was going on. We now began to see a kind of mixed priority and mixed picture. Because those who the thing were meant for, they were hesitant to take. The centers that were supposed to be administering had nothing much to record. So instead of the vaccine wasting, some would just queue up. They might not even be part of the group that were going to benefit. But because nobody will love zero recording, and they just say, look, instead of maybe breaking this thing and going home with it, can we just administer? And so there is no time we are not going to see picture where those who are not supposed to be among the first group must have taken it. And those who are supposed to be among the first group were hesitant to take. So it was difficult to really come out to say, you know, A for A and B for B. That is one area. Now to think of how many frontline workers, how many of these aged people were still on ground, that is a matter of statistics. And you know, one of the chronic diseases that we have in this country is statistics and reliability of our statistics and figures. The question is, what is our geriatric population? Somebody should come on board to see. Who are these frontline workers? And how do you even describe frontline workers? I can tell you conductors of buses are even frontline workers as well. But when we say frontline, maybe health workers. But military workers, they are even teachers who are cohabitating with students in the classroom. They are also frontline workers. But then let's forget about that and address the real issue. To get the figure remaining, out of 200 million people, we only got over 3 million maybe doses coming in. You could imagine what the number America was vaccinating on daily basis. And now how much is taking us to even get rid of 3 million dosages. So until we get the figure of the geriatric population, because initially we are saying we have a young population in Nigeria. That is why we are not dying. That is why we are protected against COVID-19. All this young population issue or no population, we need to come on board and say our 40 to 70 or 50 to 70 is this figure. Less than 40 or 20 to 40 is this figure and should be reliable. So as it is now, I can tell you we're only going to be working with what our authorities give us. It is not because they are what I can call watertight, figures that we are getting. So by and large, when they roll out the second time and you still begin to see 50, 60, 70 coming out, they roll out the third time, 50, 60, 70 still coming out, or front line workers started to come out or start to come out maybe months after now. Don't be surprised. We have to address our own peculiarity in this country. Thank you very much.
Thank you. Dr. Aribabu, thank you very much. There are so other questions here. We can take them. So, Dr. Madu, Jibade, please, your questions are noted. The DG of NCDC has requested that if there are other concerns, we should send to his office, and he's going to handle it for us. So don't worry. We certainly will answer your question as we move on in the program. Let me now call on our moderator, Alhaji Ahmed Ayekasai, for his final word. Moderator, sir. Unmute yourself. Unmute yourself.
Thank you. Thank you. The chat room master. You like chatting. Thank you very much. I really, really appreciate the presenters, the speakers. I have no doubt on what Professor Wanang and Dr. Ade can do. You have done justice to this topic. And I want to tell you, you have allayed all the fears on the meat. People now, they have accepted, from what I have from my neighborhood here, they have accepted that vaccines are safe. to not cause infertility. People will have 1 or 2 side effects to show that, yes, the vaccine is working. If it doesn't work, that is a problem. There is no microchips, no tracking device by Bill Gates. They are all lies. And of course, people think of natural immunity. Is it safer than immunity from COVID-19? But it's still better to have the COVID-19 vaccines to protect yourself, even if you will have the natural immunity, but you won't know when you will have the natural immunity. Thank you for this very rich debate. I would now like to appreciate the organizers, the president, Prince Julius Adelusi Adeli. The man doesn't want to be old, he's always looking young. Even Professor Atui, Lolo Ojo, I don't know from where you're getting this energy. We'll really appreciate more topics. After COVID-19, come up with another topic. We'll be there to support you. Thank you. May God bless this session. As we go
Thank
into
you
the
so
session
much,
tomorrow,
Alaji
may God
Ahmed
be with us.
Yakasai.
Thank
We appreciate you. I love the energy that you have. Right from the first day that we spoke about this, he was asking me 2 days ago that where do I get energy from? But he suggested something, but he doesn't want to say it in public. So we leave it at that. We leave it at that, Alaji. So,
Well,
ladies and
you're
gentlemen, it has been a wonderful day. You are wonderful people, wonderful audience. On a Monday morning, we know you have one thing or the other to do, but we have all been here. I will now call on distinguished Professor Cecilia Iguilo to do a summary for us within 3-5 minutes.
Go straight to the summary. The Nigerian Academy of Pharmacy and the Nigerian Guild of Editors held its program on COVID-19 pandemic at the Business School of the Netherlands on 12th of April 2021. The theme of the program was COVID-19 facts, myths, and the way forward. This program was anchored by Dr. Lulu Ojo and Mr. Azu Isiekwena. The program was declared open by Prince Adelusi, Prince Julius Adelusi Adeluyi, the president of the Nigerian Academy of Pharmacy. In his speech, he stated that there is need for this unique collaboration between Napharm and Nigeria Guild of Editors and other organizations to complement efforts of the government to mitigate the impact of the pandemic on the people. He urged the government to beam their searchlight on research and development and promote scientific research through improved funding and better motivation of researchers, enhance the capacity of the nation to tackle future epidemics speedily. The keynote address was delivered by the DG Nigeria Center for Disease Control, Dr. Chikwe Ihekwazu. The impact of the pandemic, as he stated, has resulted to the loss of over 2 million lives, over 28 trillion US dollars lost to global economy, fractured societies and the economy. Initially, there were 4 laboratories he mentioned, but we have now over 80 laboratories. The laboratories have now have the emergency operation centers. He advised that there should be building of capacity for preparedness for the next epidemic or pandemic, although we're not praying for this. Through the use of digital surveillance, training and protection of healthcare workers, strengthening risk communication by taking responsibility, establishment of the National COVID-19 Research Consortium, science at the front line of the response. He indicated about 6 published articles with about 20 manuscripts under review, and that the next concern he mentioned to us is that antimicrobial resistance, that this could be addressed through surveillance and proper response. The panel of discussants was moderated by the immediate past president of the Pharmaceutical Society of Nigeria, Pharmacist Ahmed Yakasai. And the panel of discussants were Professor Wanang, Dr. Adeye, and the Dr. Issa Mustafa, though the network had a network problem. Professor Wanang mentioned that COVID-19 has suffered a lot of controversies. Our healthcare is in shambles, he stated to us, and that there should be work on human capacity, and government to make deliberate effort to educate the people, should bring the research together into a single pool so as to make progress in our systems. Dr. Adeye mentioned that the novelty of the virus makes everyone to suspect the other. He expressed the need for education also, advocacy, teleconference, webinar, and also the control of the pandemic. The real science is the only option for this pandemic. Thank you very much, and we look forward to tomorrow's programs. Thank you.
Distinguished Professor Igilo, thank you very much, ma. To the audience, we thank you so much. Even at this point, we have 97 in the house, about 12 to 15 watching on YouTube, and for those of us who are physically present. Let me therefore call on the president of the Nigeria Academy of Pharmacy, our dear Prince, to please give the closing remarks, and of course, hand over our token of appreciation to the speakers, panelists, and moderator. Thank you, sir.
Thank you very much, ladies and gentlemen. We've had a very useful day, of intellectual exchange of ideas, and we've profited from this. So the first thing I'll let you know is that the organizers have made sure that we have some plaques just to show appreciation to those who have in fact participated. I see that these plaques are rather expensive looking, but there are plaques for the Honorable Minister, who by the way just sent me a message that they've been held up. In this country, you're not quite sure of the next 10 minutes you can be sent for as a minister or as a functionary or in public office. So there are some plaques made, one for the minister, one for Ihekwa Zoo, another one for each of the 3 discussants. And since, Jimmy, you are here, I would kind of symbolically give you yours, and the others can assume that theirs have been given, including our friend and brother, the immediate past president of the Pharmaceutical Society of Nigeria, Alhaji Ahmed Ibrahim Yakasei. But this I'll give to you. With thanks from the Academy of Pharmacy and from the Nigerian Guild of Editors. Thank you for participating. Yes, and the others now, I think the organizers will have to arrange to get them delivered. Like I say, are you there? If you're there, just be assured, be assured that yours is here. Yes, yes. What we will do is send it to you by email, and you can download. Professor Wanang too. In this age of technology, don't just laugh. It may just be possible. We'll send it to you also, Professor Wanang, for the wonderful presentations you've made. And you get, I can assure you that those who made these plaques have tastes. So that's about that. I think we've had a good day. It was also very enriching to listen to Dr. Chike Andrea's Ikweazu. And we have good people in this country. It's good for them to be exposed to efforts like this so that they will know that there are people who want to join efforts with government for the sake of the people generally. But this is only the first day, and I understand that we've had about 120, 130, 135, 140 people. Very good. Tomorrow is another day. If you don't have your questions answered today, or you want to make some comments, please feel free to join us tomorrow. Tomorrow's theme is it is about the role of the media, and the chairman is Professor Tony Radia, who is the former CEO of the National Orientation Agency. And the keynote speaker is Dr. Ruben Abati. And then the panelists include Kingsley Uranta of Channels TV, Dr. Oladipo of Eagle Online, and Max Amuche of the Sun Post, then Dan Lamy of the News Diary Online. Now, our moderator tomorrow is Dr. U.N.O. Waga, who is also a former president of the Pharmaceutical Society of Nigeria and a fellow of the Academy of Pharmacy. So we look forward to your joining us tomorrow, and we know that matters pharmaceutical always work out well at the end. We appreciate also the people who are making the major reports for us, and their boss is the distinguished Professor Cecilia, our sister. Your presentation has been expectedly quite comprehensive. Well done. So I say that in closing, we have got most of our aims achieved today. The minister didn't make it, but he has indicated that sometimes during the week, if we can include him, he will be quite pleased. I'll leave that to the organizers, and I really appreciate your coming.
A round of applause for our chairman. Thank you very much, sir. Let me now call on the chairman of the Napharm NG Committee on Special Program on COVID-19 Pandemic, Sir Ifeanyi Atueyi, for his vote of thanks. Sir Atueyi, please.
Well, I want to thank all those who have been part of this program. There are those who are here physically. Please, I appreciate all of you. And as has been said, about 134 taking part virtually. And we know this is great, as far as I'm concerned, for Monday morning to assemble these people who are meant to be busy in their offices starting the week. So I'm sure that tomorrow this number will double. The minister should have been here, as the president has explained, but I thank him for his spirit that was here. He was not virtually, he was not physically, but I know the spirit of the minister was here, because up to this morning, he planned to be with us. I must again appreciate the MD of the NCDC, Dr. Chikwe Ihekwazu. He has spent his time and given us very comprehensive keynote address. One person I'd like to appreciate who has been with us, and people do not know that he's our colleague, is pharmacist Raji, who is our technical director. All the things we have been doing here are on YouTube and social media. And when you see him in his technical outfit, you just think he's a technical man. He is a pharmacist actively practicing today. It's a pleasure to have you, Mr. Raji, pharmacist Raji. The purpose of this program is being fulfilled. We have got the Nigerian Guild of Editors working with us, and this program has been planned to be what we can call in Igbo language as Obunigwe. This is the program of programs we are having on COVID-19. Some have been organizing these programs. In fact, today, Nigerian Academy of Engineering is having one. We have been invited for 3 hours. But this is the only one we have decided to run for a whole week, starting from today, every day, from 10 o'clock to 12 noon, up to Saturday. And there's no professional body that has done it this way. The purpose is that what people do not receive in this program, where will you receive it? We have lined up all the authorities, we have lined up all the specialists, and they'll be with us throughout this week. So I encourage you, those who have been here today, please join us tomorrow. And those who have missed today because of other engagement, we expect you tomorrow. I want to thank all for coming, and in particular, I should thank the president of Napharm, Prince Julius Adelusi Adelui. This is the time I'm seeing him physically after a long period. So it's my pleasure to see your face once again. Thank you, distinguished Professor Cecilia Iguilo, for this summary we have received. I want to thank the journalists that are here present, and most of them are online. I know that we shall educate and inform the masses. This is why we are collaborating with NGE. What we cannot do on our own, NGE cannot do it. So thank you very much. Everybody is appreciated for contributions we are making to make this program a very successful one. Thank you very much. Thank you, my Director of Programs. Thank you.
Thank you, sir. Round of applause for our dear sir, Ifeanyi Ateyi. We have a lot of people in the room. We have Dr. Seyi Roberts. Did you notice him? Yeah, Dr. Seyi Roberts, you've been around since. That's really great. When we are talking of collaboration, this is just the beginning. A lot of things will happen. It is our nation, and we have a responsibility to make it great. So we will do a lot together. So Dr. Roberts, we thank you. I think I mentioned Dr. Blessing Chukukelu. He's the Director of Training and a consultant family physician at Eco Hospital, and has been with us since. Thank you very much. We appreciate you. And we also have in our midst the Obileye Oluwayemisi, of Ogun State Ministry of Environment. Thank you very much. You've been around. I've seen Dr. Uwaga, former president of Pharmaceutical Society of Nigeria, former president of Nigerian Institute of Management, and so many other distinguished ladies and gentlemen. I've told you about, we've been doing a lot together. Okay, time will not permit us. Oh, wow, our mama is here, Professor Bankfemi Oyewo, who incidentally turned 70 recently, the chairman board of fellows, Pharmaceutical Society of Nigeria. She has been around. Look at our mama, does he look 70? I'm sure no, she doesn't look 70. What we are saying is that you may have to do this birthday again because we don't believe this age, So I think this is a very good one we've had. I've seen Tayo Amzat in the house. Tayo Amzat, are you in the house? No, I want to give a closing prayer. Tayo Amzat, the Vice Chancellor, Christian University, Professor Chinedum Babalola. She has been in the house since morning. If I keep on looking, we will not leave here. All the days, yeah, that you are right, man. You are right, man. I saw Dr. Glory. I saw, please, you are all wonderful. Thank you so much. You are there. Tomorrow day, as our president has said, let us be here. We'll be talking about the role of the media. So the media people will take over tomorrow. Dr. Waga will be moderator. He'll be working with Ken Ogbeche for the role of media tomorrow. So, Tayo Amzat, if you are there, can you give us a closing prayer? I'm sorry, some people complain that they've been waiting they have been in the waiting room for long. Our technical director, I got some complaints that nobody now, but some people complained they waited for too long. Tayo Amzat, are you there? You are not there. Okay, Kabiru, over to you. Just a word. You can't leave the console. No. Okay, they will do it for us. Okay. Distinguished Professor Gilo, the man to fall on you for a word of prayer to close the day.
Our Father and our God in heaven, we bow unto you in reverence, in worship, in adoration, in appreciation. We thank you again, Lord, for our lives. We thank you for the Nigeria Academy of Pharmacy, our president and all the executive. We thank you for the Nigerian Guild of Editors, their president and the executive. We thank you, Lord, for the outing today. If not by your spirit, this would not have held. Lord, we appreciate you for what you have done, for you use this avenue to reach out to many souls that are troubled. Lord God, we thank you for your peace and your healing, even during this pandemic. We appreciate you, Holy God, for the rest of the week. All that will be done was handed over to you, Lord, that you grant increase to our efforts. For without you, Lord, we can do nothing. We appreciate you. We thank you. We give you praise and glory. For in Jesus' mighty name, I have prayed. Amen.
Thank you, everybody. We're handing it with 73 participants, and this is just 12:35. We had already scheduled that this will take 2 to 2.5 hours. I think we all deserve a round of applause. Everyone. Thank you so much. Thank you so much. Tomorrow is another day. 10 o'clock, the role of the media in the management of COVID-19 pandemic. We want more Nigerians to come. Come and clear your doubt. No need for conspiracy theory and all sorts of things. Thank you. We appreciate you. Thank you, Mr. President. Thank you, Dr. Aribabu. Thank you. Thank you, everybody. Thank you, distinguished professor. Thank you, our Vice Chancellor. Nigerians come on men to serve our Father. Tomorrow is another day. Thank you and thank you. C49, fantastic.